10 months of fighting in Sudan has taken a devastating toll on the most vulnerable in the population, as so often does. According to the UN, more than 25 million people need assistance, with some 700,000 Sudanese children facing acute malnutrition. The conflict between the country's armed forces and the paramilitary RSF has displaced millions both inside and outside the country. The UN says more than 6 million people have been displaced inside Sudan. Another 1.6 million have fled to 5 neighbouring countries. Beitar غراف is acting representative to Sudan for the World Health Organization. He joins me now from Cairo. Thanks for doing so. Jan Egeland, the Secretary General of the Norwegian Refugee Council, said what's happening in Sudan is, in his words, the most underfunded emergency he's ever seen. An ocean of neglect, he said. You've seen the situation with your own eyes. Would you agree with that assessment?
I can't agree more with Jan. It's the forgotten crisis. It's the forgotten humanitarian crisis of this moment. Yes, Michael, I agree with him.
The UN says half of the population, as we said, 25 million people need support and protection, millions hungry and displaced. How exactly is the world failing the Sudanese people right now?
Well, first and foremost, the world is failing the Sudanese people by not drawing attention to this crisis. So thank you very much to you and CNN for this opportunity. The amount of funding that goes to Sudan over the last years has been very limited compared to the crisis it faces. The humanitarian needs and response plan of 2023 was grossly underfunded, and the plan for this year is not looking very well either, despite the fact that the plan only targets a small proportion of those who we would really should be reaching at this moment.
Yeah. Apart from hunger and the war itself, I know that you've spoken about childhood immunisation programs breaking down, and you've got infectious diseases spreading, waterborne diseases and so on. How is that worsening the already awful situation?
So, Michael, what happens is, let's say when mothers and children are hungry and starting to get close to starvation, your, let's say, natural defenses go down. So then when you get ill, and when you get ill from the, let's say, the most basic childhood immunizable diseases, the chances of dying, severe disease and dying increases. So let me give an example. So you may have heard from the little study that MSF has done in the Zamzam refugee camp in Darfur. Well, when you talk about the refugee camp, this is a camp, we don't even know how large the population is, but probably somewhere between 400 and 500,000 people. They found severe hunger already. In subsequent discussion with them, we've realized that we have a very large cohort of young children that have never been immunized. So if, for instance, measles would hit that camp with a population that is already so malnourished and immunocompromised, it will burn through that camp and there will be many deaths. So that's why I try to draw attention to this, especially since there are possibilities to reach them if we can move the supplies cross-border from Chad.